I'm Dr. Kamran WECT, or some people call me Dr. Kamran. That's basically my first name. I'm a general vascular surgeon. I've finished medical school in 1978, and I've basically been in practice for quite a few years. I received my MD degree from University of London in England. I did 2 years of postgraduate training in England in general surgery. Then when I came to the United States, I started all over again with general surgery. I spent another 5 years, and I'm board certified from the American College of Surgeons here in the United States. I'm also board certified in phlebology. Phlebology is the science of venous disease or diseases of the veins. I believe my certificate number was like 150 or 140, so I was one of the first, at least 150 to 200 surgeons in whole United States to get board certified in phlebology. I'm a clinical professor from the University of North Carolina in Chapel Hill, and I'm a fellow of American College of Surgeons and fellow of International College of Surgeons. Varicose veins are ropey, large veins that one can see underneath the skin. I'm sure most people have seen people in the street with these large veins that look like little snakes sticking out underneath the skin. Now, there are two types of veins. There are the deep veins, and there are the superficial veins. Superficial veins are the veins which are right underneath the skin. We are all familiar with superficial veins. When you go to have your blood drawn, they are drawing the blood from your superficial vein. And when they inject it or put a needle in it, the chances are that particular vein is going to go. You'll have another one in its place. So the superficial veins are not important. They are part of the venous system. So blood gets to the leg through the arteries. It gets out through the veins. The pressure which pushes the blood into your leg is from your heart. When your heart pumps, it creates a pressure of 120, 130, 140. We've all heard about blood pressure. That's what blood pressure is, the amount of pressure the heart exerts on the artery. Pushes the blood down to your leg. So that blood at your foot, at your ankle, or at the tissue, the only way it's going to get back to your heart, there's not another heart in your foot. The blood has got to get back out through the vein. And the way it gets out is through your muscles in your leg, particularly your calf muscles. So when the calf muscles contract, just like a pump, it pushes the blood out. And when they relax, there are valves inside the vein which stops the blood from falling back down. Arteries don't have valves because they don't have to. The heart is pumping the blood out. Veins need valves. Now, if these valves fail, the blood does get pushed up, but when the muscle relaxes, the blood comes right back out, backwards. So essentially, you have no flow in these veins. Blood is going up and then falling back down. It is not moving. It's just going up and down. That's all it's doing. So when you have large varicose veins, at the end of the day, when you look at your leg, and your leg has all these veins engorged with blood, that is the blood which is not circulating. It is sitting in your leg. So if we destroy those veins, if we get rid of these bad veins, then the blood can get back into through the deep system, back into your heart. And that is one of the reasons I believe when I treat patients with venous disease, they tell me their leg is not as tired, they can walk further, they can do more. And I bet you that the heart probably doesn't have to work as hard either because blood is getting back into the heart so it can get pumped out. Remember, heart is just a pump. What comes in gets pumped out. We all know you don't want to run your pump dry. You don't want your pump to be empty. You want it to be full. You want to make maximum of your circulation, of your blood volume. And that is why venous disease is so important, and I don't think they have paid all the attention that we could have in the study and treatment of venous disease. We at the Scarless Vein Care provide free consultation for the simple reason that venous disease is a very commonly undiagnosed or underdiagnosed condition. And the bottom line is, I feel by providing them with a free consultation, it alleviates anxiety, allows them to come in and see us and ask their questions. Now, during that visit, it gives me an opportunity to make a diagnosis if indeed that is what's bothering them. So if they do not have venous disease, they go and see some other physician who could help them. And if they do have venous disease and they decide to come back to see us, of course, I'm always very glad to see them. Spider veins are usually cosmetic. They look ugly. They don't look good, but not necessarily. I've had patients who complain of pain around the spider veins. They literally sting or they hurt. And there are some spiders which have no symptoms at all. There are others which hurt. I guess if they're close to a nerve, a skin nerve, they would hurt. Brain wave is a very interesting technology. Basically, we utilize microwave technology in order to treat very small spiders and superficial veins. The thing which is very exciting about it is that you can have vein wave treatment and go right in the sun. You do not have to avoid sun. When you have laser treatment, usually you have to avoid the sun before and after. So it is definitely very good about that. It also allows us to treat very, very small spiders. Some of these spiders are so small that they cannot be injected. They are not amenable to sclerotherapy. Vein wave works particularly well on the face, on the small spiders, or what we call telangiectasia. These are very tiny veins on the nose and around the face. What sclerotherapy is essentially destroying small spider veins. You're trying to get rid of these spider veins because they're unsightly. Patients don't like to look at them. And the way we do them, we inject a medication into the vein, which will destroy the vein. USGS stands for Ultrasound-Guided Sclerotherapy. We've already talked about the sclerotherapy. With USGS, you go one step further. There are veins that you cannot see. They're deep. They're feeder veins to those tiny spiders. And the way we treat them, we look at them with an ultrasound, and then we inject right into the feeder under the guidance of ultrasound. Laser ablation is essentially replaced what we used to do in the old days, which was venous stripping. And I personally, again, it's my own personal opinion, believe that venous stripping should essentially be obsolete. Now, the way we are enabling ourselves from not doing venous stripping is to do laser ablation. We just put this small laser. These laser filaments are very tiny now. They're just a few millimeters. We put them inside the vein. So instead of ripping and tearing and pulling veins, we just destroy the vein from inside out. And because you're not doing any cutting, because there is no cuts, there's no stitches, etc., you can do it in the office and the local. And that has really revolutionized the art of venous treatment or treatment of varicose veins.
Because of the tiny spider veins on my right thigh, I've always hesitated wearing shorts. After my appointment with Dr. Kamran, I know that I have found the right doctor. The knowledge, the kindness, the passion he has, he loves what he does. Who wants to go through life hiding? Now I don't have to. Nice legs, Dr. Kamran. Scarless Vein Care by Dr. Kamran. Call for your free consultation and learn more at scarlessveincare.com.
The symptoms which are associated with venous insufficiency, or the discomfort caused or the symptoms caused by venous disease, are the following. I've noticed that probably one of the strongest indicators that one has venous disease is night cramps. And I would have, if you asked me that 20 years ago, I would have never, that wouldn't be the first thing which would come to my mind. But a lot of patients with venous disease, with venous insufficiency, get night cramps. And when I treat these patients, the first thing which seems to go away is the night cramps. I think it's very important for patients to know if you have night cramps, I would definitely ask your doctor if you could have venous insufficiency. Now, the other symptoms, of course, are the heavy, tired feeling. You know, we all get tired at the end of the day, the leg hurts. We think it's just normal. It's a normal way of living, working hard, but not necessarily. You don't have to hurt in your legs just because you're above a certain age. Sometimes it is caused by venous insufficiency. And one of the ways of finding out if you put your leg up, pain goes away, the chances are you do have venous insufficiency. If you wear compression stockings and the discomfort goes away, the chances are very good that you have venous insufficiency. If you have burning or heavy, tired feeling, burning sensation where your varicose veins or your spiders are, or you feel a little bulge where you're hurting, the chances are, again, your problem is caused by venous insufficiency. Occasionally we have patients who have some inflammation in the skin. It's almost like a rash, especially on the inside of the lower leg, around the ankle. They are most likely associated with venous insufficiency. And I have a lot of patients who come and see me from either a dermatologist's office, or they have tried hydrocortisone cream and all kinds of things trying to get rid of this, not knowing that they are actually caused by venous insufficiency. We call that venous dermatitis. Dermatitis means inflammation of the skin, and venous, of course, means veins. Hyperpigmentation. Hyperpigmentation, hyper means increased level of pigment. Patients who have dark coloration of the lower leg are usually, again, caused by venous insufficiency. What happens is the pressure inside the veins are so high that red cells literally ooze out of the vein. And when the red cells gets outside the vein into the tissue, it's like a fish out of water. The red cells die. And what gives the red cells their color, what hemoglobin gets its color from, is iron. So when the hemoglobin molecules break down, you get iron deposit in the lower legs, and the skin looks very dark. So it is almost like somebody getting a needle and injecting iron into your leg, having a tattoo in your leg. So if you see somebody with dark coloration of the lower leg, it's most likely caused by venous insufficiency. And of course, if you're pouring iron into the skin, into the tissue of your leg, lower leg, it causes scarring. So the skin is not only dark in coloration, but also thickened, like a leathery appearance. Most people, when I mention that, they say, "Doc, I remember my mom had it, my grandmother had it, my uncle had it, but I'm glad I don't have it because I just have varicose veins." And my argument is, the chances are that your mom, your grandma, your uncle, when they were your age, all they had was varicose veins. Now that they're older, the condition has become chronic, and now they are in the shape that they are. So it is very much advisable to, I believe, know if you have venous insufficiency, and if you have venous insufficiency, try to take care of it earlier than later. Fortunately, it is reversible. I've noticed when I treat these patients, the condition gets better. But the worse that it is, the longer it gets for it to get better. So the sooner you seek treatment, the better off you are. Patients with restless leg syndrome and venous insufficiency, when they had their venous insufficiency treated, the restless leg syndrome went away. And 75% cure or improvement is very significant. It is more than luck. I remember one of my patients told me that, "Thank you, doc, and now I can go to bed with my wife because I've been sleeping on a couch for all these several years now because of my restless leg syndrome. I was keeping her awake at night." So if you have restless leg syndrome, think about venous insufficiency. If I've been talking about swelling of the leg, I'm really surprised how the leg swells up in these patients with venous insufficiency. And when you treat them, the swelling goes down. In fact, one of my nurses, after I treated his leg, it took him about a year, but he actually went to another symptom of venous insufficiency is leg swelling. Now, there are all kinds of reasons for leg swelling: too much salt, heart failure, kidney failure, pregnancy, etc., etc. But the swelling that one gets associated with venous disease is usually what we call non-petting edema. And don't worry about the terminology. Basically, what it means, if you put your finger and push on your ankles and you leave indentation, that's a petting edema. The chances are that's not related to venous disease. But if you cause non-petting edema, then it is most likely related to venous insufficiency. And why is that important? It's important because a lot of people, because they don't see the indentation, because they don't see the marking of their stocking on their ankle, they feel they don't have leg swelling. They think that just their leg is becoming that way over time. It's not true. When you have venous insufficiency, the leg almost becomes like a pillar, like an elephant. You know, it's just straight cylindrical as opposed to have shape. Shoe size is smaller, which I would have never thought that would make such a big difference, but it certainly did, and I've seen it with my own eyes. And I definitely wouldn't recommend coming for a vein consult just because you don't like the size of your feet. But if you have venous insufficiency and you have your veins treated, the chances are if you have swelling, the swelling will go down and you might be able to get into smaller shoes. Another symptom of venous insufficiency is leg swelling. Now, there are all kinds of reasons for leg swelling: too much salt, heart failure, kidney failure, pregnancy, etc., etc. But the swelling, one of the questions that patients ask me about venous disease: okay, doc, the vein is not working, the valves are not working, why couldn't you repair them? They have been tried, and unfortunately, there has not been much success in this field. I've been lucky in that when I was in upstate New York doing part of my residency program in Albany, they were repairing quite a few of these valves in the veins, trying to get them back to the normal. Unfortunately, the blood flows very slowly in a vein, unlike an artery. So as soon as you open a vein and repair them, because of the low flow, the vein clots. And when a vein clots, there's a risk of the clot moving, getting into the heart and lung, and potentially kill patients. So repairing of the veins at this stage has not been successful. Where we stand now in the year 2012, the treatment for a vein which is not functioning, a vein which has got bad valves, is either to strip it or to destroy it with a laser or a radio frequency. And we utilize laser in my office.
My mom and I had been suffering from leg pain and leg cramps for years. We didn't have a strong relationship because we couldn't do a lot of things together. We both went to Dr. Kamran. He truly has given my mom and I a new beginning. We had a second chance to really enjoy life instead of just sitting around and feeling pain. And that's very, very special. And he's our hero.
Nice legs, Dr. Kamran.
Scarless Vein Care by Dr. Kamran. Call for your free consultation and learn more at scarlessveincare.com.
Some of the, I'm trying to bust the myth of venous disease because I've noticed over the past 12 years, 13 years, a lot of patients are asking me things which are absolute myths. So I try to go through some of them very quickly for the audience. Number one question is if they're treated, are they going to come back? And no, if they're treated properly, they shouldn't. But you always need to have some maintenance. You always, just like going to a dentist. Insurance companies don't pay for these. That is not true. If you have symptoms, insurance pay for it. If it's cosmetic, then they don't pay for it. If I have my veins treated, they're going to come back with vengeance. That is not true. I try to compare this to clipping your rose bush. If you just clipped one or two leaves or branches, you're going to get 3 or 4 in its place. Spiders are the same. Spider veins or varicose veins, if you do not treat the underlying disease, you really literally need to go to the root of the rose bush and destroy it. You just don't go and clip it. You just make it angry. So that is probably one of the reasons why they have a tendency to come back with vengeance. One of my patients asked me recently if I exercise, can his varicose veins go away? And I like him to exercise, but no, varicose veins are not going to go away. He might slow down the disease, but they will not go away. This operation is painful afterwards. It is not. The risk of clots are very high. They're not. It is an operation which is done in the hospital. It is not. It's actually done in the office under local anesthesia. There is stitching. There's no stitching. I don't stitch anybody. There's a scarring after you have this procedure. There's no scarring. They're just tiny puncture wounds which disappear. Recently, I had a patient that is venous stripped, and he had almost an inch incision. That you compare that to 0.1 millimeter, it is a whole difference. So the bottom line is no, there are no scarring after this procedure. If I bleed from my varicose veins and they stop bleeding, that I will not have any more problems. No, the chances are if you bled, you're going to bleed again. I strongly recommend you see a phlebologist. I went to the emergency room. One of the questions is, I went to the emergency room, my vein was bleeding, the doctor stitched it, and am I cured now? Well, that's like trying to stop a water balloon from leaking by stitching the water balloon. Every hole that you left there in the stitch is going to leak again. So I suggest see your phlebologist as soon as you can. If I have my varicose vein treated, I may get clots, but if you don't have your varicose vein treated, you probably will get clots. And I think the risk is higher if you don't have it treated as opposed to having developing a deep vein thrombosis going through the procedure. There's a little controversy here. If you're going to have a procedure on your leg, like having a total knee or whatever orthopedic procedure you're having done, and you have these gigantic varicose veins, a lot of my orthopedic friends refer the patients to me to have their veins treated first before they have the procedure. I think it's advisable. So a lot of my patients feel that they need to have their knee taken care of first before they have the varicose veins. I think if you have giant varicose veins or you have severe venous insufficiency, it's going to affect the healing of your leg after the procedure. So it's advisable to have your veins taken care of first before you go and have your orthopedic procedure done. I believe it was the year 2000 when FDA cleared the laser treatment of long saphenous vein, and within a year, I believe it was a short saphenous vein, they approved. The minute the FDA cleared it, I started the inception of the Vein and Laser Center of Wilmington. Since then, I've done close to 6,000 or 7,000 laser ablation alone, and we've done a lot of other vein work in the meantime. I feel a lot more knowledgeable now and skillful now than I did 10 years ago and 12 years ago, and I believe 6 months from now I'm going to be more knowledgeable and skillful than I am now. With surgery, I believe it is like flying an aeroplane. How many hours do you have under your belt? And I believe the longer you do these procedures, the better you get at it, and you continue to improve. My philosophy in Scarless Vein Care, and probably my philosophy as a physician, as a surgeon, is always try to do the best you can for your patients. I'm not saying anybody else is not trying to do that, but I believe that at least in my practice, I do my very best to be the best. Since I was a child, my parents always taught me to be the best I can be and be the best to my patients, to my friends, to anybody that I could be. In order to stay the best, you can just talk about being the best, but what are you doing? How are you showing it? And by having the latest and the best equipment and the best technology, I think that's the only time you can say that that you're the best. I buy the very best ultrasound machines that I can afford, and they continuously upgrade the technology as soon as they come with an upgrade. With the laser is the same thing. I make sure we get the best laser which comes out. There is a new laser again coming out in a few months in August, and we did the trial for the company. I'm very lucky. We were one of the 4 centers in the nation and the other 3 were academic centers, I believe. And I'm the only one in private practice who was actually asked to participate in this trial. And here we are in Wilmington, North Carolina. The other places were Chicago and Tampa and I think New York. I think I've been very lucky. I think I really thank God to have helped me to achieve some of the things I've achieved, because it's been more than luck. To have the crew, the staff that I have I honestly think it is just more than luck, because I have some of the best people working for me. I have excellent ultrasound techs. It takes a lot to, you cannot do the procedure if you don't have good ultrasound techs. And if they make a mistake, then we all will suffer. So it's important to have dedicated and smart and skillful ultrasound techs. And having said that, literally last few weeks ago, we one of the ultrasound companies came to me and said that we've just been selected as one of the centers of excellence, and I believe we are the only practice in private practice who have been considered as a center of excellence, and the other groups have been big university centers. I make a point of having at least 2 meetings a week with my entire staff, not just part of the staff, the entire staff, and usually more than that, more meetings than that. And what we're discussing, we're having everybody's input. What can we do to do things better? How can we incorporate new technology? How can we make our patients happier? How can we make the patients wait less? How can we offer the best prices to our patients? And I believe right now we're pretty competitive in our pricing. To be good and to be a center of excellence requires a lot of dedication. I don't get paid more or less to get a new laser to use on my patients or new technology, but I believe it is my job, morally and ethically, to make sure my patients are getting the best. You only stop when you have achieved your goal, and the goal is what the patient came to you in the first place and told you what the problem was.